trauma is an unfortunate daily reality, so there are some important things you can do to prepare just in case. Adventist Health Castle Trauma Program Coordinator Sarah Janoian is here to help with some prompts as well. Thank you so much for coming in. This really is an important topic.
Good morning. Thanks for having me. I'm really excited to be here.
Absolutely. Well, let's talk about some of the common culprits. What are some of the biggest causes of trauma?
Well, here on the island, we actually see a lot of falls. We have a large population of patients that are 65 and older, and they're on what we call blood thinning medication or anticoagulation. Slips, falls downstairs, in bathrooms, in the kitchen. They happen a lot, and we unfortunately see a lot of traumatic head injury. Kind of makes us unique to the rest of the states, though, where their #1 cause is motor vehicle accidents.
Really?
Okay. So we also see, your cuts, your lacerations from any kind of broken glass, or also falls too. Burns from hot water heaters, stoves, barbecue pits. Unfortunately, the occasional Simon burn too.
Really?
Yeah.
That's a real thing here.
Yeah. So no walking and eating your soup.
Oh, okay. Yes, I know. People try and do a little too much multitasking sometimes.
Yep, at one time.
And they're probably texting in the other hand, and next thing you know, they're checking in.
Yeah, might be. Might be something else.
What can you do just in case one of these things happen? Obviously, you're not thinking a trauma is going to happen.
No, there's a bunch of things. I keep a bunch of stuff at my house. It might be a little overkill for most people, but super easy things for you to get anywhere over the counter, your local drugstore, that kind of thing. Ice packs are always great to have in the house. Sterile or very super clean saline and water. Easy to also buy. Saline, yeah. To rinse off burns, cuts, that kind of thing. Gauze, this is my favorite. Roller gauze, you can use it to pack wounds, you can use it to put pressure on wounds.
It's a nice big size too.
So you can cut it, which a good pair of trauma shears, always nice to have. Elastic bandages to help hold pressure. Tape. This is called Coban, or it's a self-adhesive. It's the same stuff.
Sticks.
Yep.
Sure.
Same stuff they put on you after you go donate blood.
I remember that one.
It's just basic nitrile gloves are absolutely great. And then I also carry a tourniquet.
Okay, probably you're right. Most normal, non-medical emergency people probably wouldn't have it, but that is a good idea.
You'd be surprised.
Could you do something
though
that could improvise if you don't have that?
Kind of dumb, not exactly if you didn't have a tourniquet, being able to put pressure with either a rolled gauze roll or an elastic bandage.
I see. I'm thinking, do I have a belt or something?
What
would work?
You totally can. There's stranger things have happened, so you can kind of, this is on myself, obviously. It's a little harder to demonstrate, but pressure. And
there you go.
Tighten it down and stop that bleeding if there's any reason for it.
Is there an actual kit that someone could buy if they were interested in having?
So there are kits available.
Or do it yourself.
Everything's available online anymore. It's easy to Google. Amazon's awesome for that kind of stuff. But it's really easy to put stuff together yourself. Like I said, pretty much all of this stuff, minus the tourniquet, is available at your local drugstore.
Take your pick. Name X brand, X here. But are there programs too where you can also help educate people like we're doing right now?
Which is awesome. And we're here at Castle, we're building programs too. But we do a Build Your Balance program, which is to help build core strength and coordination to help prevent with falls. We also offer programs for child seat safety so that they're in the right size and that it's installed properly. Looking at pedestrian safety, super important with the keiki. Make sure they're paying attention. Helmets with bicycles, skateboards, hoverboard. Yes, all those fun things. And then, like with burns, there's a lot of burn education out there, but remembering ice is not nice when it comes to burns.
It's not. See, I think a lot of people, that's the first thing you think you need. What should you do?
Rinse it off with some clean water, lukewarm water. All right. Put some sterile gauze on it and get yourself over to the emergency room.
And don't put anything else on it. Everyone might think of the alloy or something.
No butter, no toothpaste, just clean water and some dry gauze, and come over and
just like that.
Yeah.
Well, thank you so much for giving us this education for all you did. People who at home know, but my son, we had to go to the Castle ER when he fell on one of those hoverboard type things. So, yeah.
It's not that we want you to get hurt, but if you need us, we're here for you.
Oh, well, thank you so much.